Just 1 second, I'm having trouble getting to my slideshow. All right, can everybody see that?
No, I think you might not be sharing.
Sorry about this.
There we go.
All right, is that better?
Yeah, perfect.
Okay, cool. All right, so welcome everybody to the Midwest Tribal Echo. This is the Opioid Use Disorder Education and Treatment Series. Today we are excited to welcome Walker Bosch from the Wilder Foundation, and he's going to be discussing the findings from the Minnesota Homeless Study. A little bit about NACC, if you're not familiar, we are an FQHC located in South Minneapolis, been here for over 20 years. And this is a list of all of our services that we provide. We have our website down at the bottom there. So if you'd like to learn more about us, we do have a newer website. Feel free to check that out. This is a list of current open positions. You can go to that website at the bottom again, go to the job section and read more about what we are offering at this time. And then some session guidelines, please note protected health information. We love to see your faces. So if you are willing and open to turning your cameras on, that would be great. And then if you could just let me know who you are in the chat, your name, title, organization, and email, I can get information over to you after the session. This is a list of other echoes that we recommend that cover similar topics as us. And so if you'd like more information, feel free to reach out to me. Other announcements. So our next echo session is in 2 weeks on June 18th. And members of the SWIM collective, so Sex Workers of Minneapolis, will be joining us to talk about current projects and things that they're working on. We do meet the first and third Wednesday of every month, just so you know, from noon to 1 p.m. And then case presentations, my email address is on this slide. If you have anything to share, feel free to send those over to me. They make for a great discussion. And I think that's it for me. I'm going to stop sharing and I will hand it over to our speaker today. Welcome, Walker.
Thank you. Let me get my slides ready to go here. All right. All right, everybody see my slides here? Okay, thanks. All right, so thanks for coming, everybody. Again, my name is Walker Bosch. We'll be talking about the Minnesota Homeless Study. I'm a research analyst at Wilder Research, and I think initially we were going to have Michelle Gerard or Rebecca Sales, the co-directors of the study, but you're getting consolation prize me today, but I am the newly minted analysis director of the homeless study. So there's that. If you're not familiar, or I've been at Wilder Research for almost 15 years now. I've been working on the homeless study for since 2012, so the last 4 cycles of the homeless study. We work at Wilder Research, which is a part of the Wilder Foundation. It's a nonprofit research and evaluation group. We work with all the groups listed here on a wide variety of topics. Housing and homelessness, obviously, given the topic today, education, criminal justice. I'm also involved with a project that we are working on in consultation with a professor at the University of Minnesota. We've done a few of these projects with Native American tribal nations where we work with them to project their populations out into the future based on different blood quantum eligibility criteria to So that's some of the stuff we do. Um, so just a bit of an agenda today. What are we going to talk about? We'll do a brief background on the Wilder Foundation and Wilder research, some of which I've talked about already. Get a little bit of history and background on the study itself, and then we'll talk about an overview of some key findings.
I haven't left my
We
water.
have some Q&A. All right, so the Wilder Foundation. The Wilder Foundation was formed in 1910 when the trusts of Amherst Wilder and his wife and daughter Cornelia and Fanny Wilder were joined with the mission to relieve, aid, and assist the poor, sick, and needy people of the city of St. Paul. So it was a pretty progressive mission for the time. The early services included things like free public health home visits. Um, those went for 37 years, and eventually the Ramsey County took that over. There was the Wilder Relief Department, which just gave cash relief to sick, elderly, and families with what they termed at the time worthless husbands. So um, that one, there's the Wilder Baths and Pool, which just provided uh, bathing facilities for people who didn't have them in their homes. Wilder Dispensary, which also provided free medical and dental care. And then the Wilder Child Guidance Clinic, which is actually still in existence and is one of the oldest child mental health clinics in the country. Current services are mainly children's mental health and wellness, both in schools and in clinic settings. They have aging services, how um, some refugee services, uh, substance use treatment. So it covers a really wide variety. And in case it wasn't clear, we're a service foundation. We don't provide grants to we're not like a grant making foundation. And I'd also like to note here that while the charge of the foundation is, especially for the time, was quite progressive, that Amherst Wilder gained part of his wealth through exploitative business practices just generally, but also specifically with Native Americans. And he also made some of that money through government contracts, aiding the removal of Native Americans from their tribal homelands. And if you want to learn more about that, there's a link above here. It's pretty easy to find. You just go to the About Us tab on the website, and then there should be a history link. So the Minnesota homeless study, the very first study statewide was in 1991. There was a pilot study in 1984 and I think 1987, but those were only in the city of St. Paul. And that was started because there just at the time was not really any data for policymakers, for service providers to inform their programming and decisions. So this is the team from that very first study. 3 of those are still working on the project today. Marilyn Conrad's in the middle on the table. She still helps us format the reports and everything. Standing up in the middle is Michelle Decker-Gerard. She's now one of the co-directors of the study. And then standing up beside her on the right is Phil Cooper, who actually helped me a ton with the cleaning and analysis of this study. So starting in 2006, we started a companion study to the statewide study, which happens on 6, where we partner with 6 reservations throughout Minnesota, Bois Fort, Fond du Lac, Leech Lake, Mille Lacs, Red Lake, and White Earth. In 2023, the Upper Sioux community piloted participation as well. Generally, those data are not included in the presentation today, just because tribes own their own data. So we assist them with the analysis and reporting of their data, but they control what is reported, where, how. So anything we report of that has to be approved first. And we're still kind of going through that approval process of reviewing the reporting and what, if anything, they want to share out. All right, so how the Minnesota homeless study works. When do we do it? We do it every 3 years since 1991, with the exception of this most recent study, which was 5 years after the previous one. And that was just because of COVID. There was too much going on during the time. It was unclear whether it was safe to do it, and the homeless The homeless service shelters, they were just overwhelmed with everything that was going on with COVID. So we pushed back 2 years to 2023. How do we do it? It really is a partnership among many people, homeless service field, the shelters themselves, the continuum of care coordinators, state and local governments, funders, and really the community themselves. What is the data? Most of the data we'll be talking about here comes from the one-on-one interviews. There's a screenshot here of the first page of the interview. That's really where it's a pretty in-depth interview. It's quite long, pretty invasive questions sometimes, but really a pretty rich picture of what's going on among people experiencing homelessness. Then there's another set of data that we don't use as much, but that provides shelter counts just because we want to be able to come up with the total number of people homeless on the day we do the study. But we can't interview everybody. So we get some data from HMIS to get total counts of people staying in shelters. And also we collect some data from shelters that don't participate in HMIS. Where we do the study statewide, we try to get into every shelter that we can. In Greater Minnesota, generally, shelters conduct the interviews themselves, though we do occasionally send staff and volunteers. We also, like I said, do have the companion reservation study that is generally on the 6 reservations that I mentioned before, with the 7th, Upper Sioux, piloting participation, this most recent study. And then we do interviews in both shelter and non-shelter sites. So we go to encampments, feeding sites, homeless connect events. We also interview people who are doubled up with friends and family. A lot of studies of homeless generally don't include people who are doubled up. But we interview them if they're at one of these sites, a feeding site, or an event that targets homeless people experiencing homelessness. And then as long as they meet some certain criteria, like they've been without a permanent place to live for a certain amount of time, they can be included in the study as qualifying as experiencing homelessness. Who do we interview? We interview 1 adult per household, just so because we ask how many people are experiencing homelessness and interview everybody, then we end up double counting people. So we interview 1 adult per household, and then we interview all youth aged 14 to 24 who are unaccompanied by guardians. So in 2023, we completed approximately 4,600 interviews at 400 sites with about 1,000 volunteer interviewers. And truly, we could not do this without the help of shelter staff. If there are any of you here, big thank you to you. Sometimes they do the interviews themselves, which is a significant amount of time. Other times they clear space for us to come into their shelters and do this, and it can be quite disruptive. They've got enough to do already, but helping us to do this is really, really, we couldn't do this without them. And then we also get a lot of help from street outreach workers to interview people who are unsheltered. They know where people are staying. They've got a lot of trust with those people. So again, we couldn't do this without them. The interviewers are all volunteers. It's not an easy study to do. The interviews are long, complicated, and sometimes the interviewing locations are not super conducive to doing interviews, and so we appreciate all of their help. And then last but not least, all of the respondents. This is, like I've said, quite a long interview. It has some pretty invasive questions, and there's not a lot of benefit directly to them. We reimburse them for their time a little bit, but not as much as we would like to be able to. And so we really appreciate them opening themselves up to us and completing these interviews. Right. So what are we seeing across Minnesota? Since 2018, we saw a a mild decline in the total count of homelessness, so from 11,371 to 10,522. It's about a 7% decline from 2018 to 23. Again, you can see that 5 years from 2018 to 2023. It's not labeled in here, but that's COVID. We just couldn't do the study with COVID happening. You'll also see that dotted line between 2015 and 2018. 2018 was the first year where we were able to work out with the tribes that are part of the reservation study, including that data in the total counts of homelessness to provide a fuller picture of how many people are homeless in the state of Minnesota. So that's part of the reason for that 15 to 2018. But even if you took out the data from the reservation study, homelessness, the total count in 2018 would be slightly higher than 2012, which was at that point still the highest count we've seen in our study. In 2023, it's still right around 9,000. So we're still kind of in the neighborhood of where we've been since about 2009. And with this graphic, it's always a little jarring to me. You see, ever since about 2009, the number of children with parents is about the same as the total count in 1991, which is very sad to me. All right, and so who is homeless? Who is the homeless population? Almost half of people homeless in Minnesota are people and families, either kids or their parents who they're staying with. 30% of the homeless population is minor children who are with their parents. Um, it's not the image that we generally have of the homeless population, which is people who are unsheltered asking for money. There are, again, almost half of the homeless population is people and families. So I gotta move my thing around here. Among people who are not in this, so this is everyone of people who are not in the formal shelter systems. That's people who are doubled up with friends and family or are staying outside. The percent of people who are in families from that group is about 30%. And we don't have exact numbers from people who are primarily unsheltered because this data from this slide comes from those shelter counts. But of people staying outside primarily, the share of people who are in families is quite low, but it's also not zero. Okay, so in terms of racial and ethnic identity of people who are homeless, you can see that there's just a really huge overrepresentation, especially of Native American people, but also of Black, African American, and Hispanic or Latino. So of all adults in Minnesota, 2% identify as Native American, 20% of homeless adults in Minnesota identify as Native American. If we include the reservation study data in here, which is approved to share because we can share basic demographic data, that number would go up to 30%. So 30%, if we include reservations data, homeless adults in Minnesota identify as Native American. Similarly, for Black African American, 8% of adults in Minnesota, 37% of homeless adults in Minnesota. Hispanic Latino, 5% of all adults, 18% of homeless adults in Minnesota. And just want to acknowledge briefly that these patterns of results like this don't happen just because people make bad decisions. These are a legacy of hundreds of years of policies in our country and in our state. And these are the living legacy of those laws and policies. And yeah. So where are people located? About 2/3 of people experiencing homelessness in Minnesota are in the Twin Cities metro area. About 1/3 are in greater Minnesota. That's in comparison to about 55% of the general population in Minnesota living in the Twin Cities. So there is a somewhat disproportionate number of people experiencing homelessness in the Twin Cities metro. That said, while there are fewer people experiencing homelessness in greater Minnesota, the people who are homeless in greater Minnesota tend to have higher rates of complex challenges that perpetuate homelessness. So current and past trauma and experiences of violence and exploitation, um, significant health issues, mental, physical, chemical. They're less likely to be in formal shelter system, spending more time doubled up. They move more often and have more repeated episodes of homelessness. And then when people get turned away from shelter, when they can't find a shelter to stay in, which is 1 out of 3 homeless adults have been turned away from shelter in the past month when we interviewed them. Primarily, people end up staying outside. You can see on the bottom row there, only 15 to 17% of people, when turned away from shelter, are able to stay with friends or family in houses or apartments. The rest primarily end up either outdoors or at an encampment or staying in another place that's not meant for housing, a car, a vacant building, buses and trains. And this has all kinds of, these are very vulnerable places to have to stay. And this has all kinds of consequences, which we'll get to here in just a second. So now we'll take a closer look at unsheltered homelessness and understanding the experiences of those people who are primarily sleeping outside. So in our interview, we ask respondents where they've slept in the last 30 nights, and we break it down into various categories. So things like, are you staying in a shelter? Did you stay doubled up with friends and family? Occasionally you get people who stayed in their own home or apartment, but generally with those people, they're about to be evicted, which is why we are interviewing them. And then also, are you staying outside or in a place not meant for habitation? So they do their best to estimate where they've stayed in the last 30 days among those categories. From here on, when I talk about people who are experiencing unsheltered homelessness, what I'm talking about is people who spent half or more of their last 30 days unsheltered. Unsheltered homelessness is really the most visible and stereotyped form of homelessness. Um, Everyone can see it when they're in encampments or people asking for money on the corner or um, sleeping on sidewalks or whatever. But these are also the people who most easily slip through the cracks of our social service systems. So what are we seeing in terms of numbers? Over the past decade, there's been a clear increase in the number of people who are staying primarily outside. In 2012, that was about 13% of the people we interviewed. In 2023, up to 23%, so almost 1 in 4 people. Similar increase in the number of people who are having to spend any time outside, up from 30% in 2012 to 39% in 2023. In terms of actual numbers of people, that 23% in 2023 translates to about 1,300 people who were on the night of the study had spent half or more of their last 30 nights outside. And even that number we know is an undercount. So unlike with the shelter system where using HMIS or other data systems, we have a pretty good idea of how many people were staying in shelters on any given night. With people staying outside, we do our best to find people, but we can only count who we interviewed and who are willing to talk to us and who we found. So that 23% and that 1,300 is really a floor of how many people there are who are primarily unsheltered on the night of the study. And then you can also see it right here that 27% of people who were interviewed inside, either in a shelter or they were doubled up with friends and family, 20% of them were also unsheltered at some point in the past month, at least one night. So it's not like, especially people who are in emergency shelter and doubled up with friends and family, these are often not super stable arrangements. People are always having to try to piece together arrangements to keep a roof over their head. And people are really just, one late check-in at a shelter or something like that, from being back out on the streets. And it's not only that, but also a majority of Minnesota's unsheltered population is also mired in long-term homelessness. And what we mean by that is their current episode of homelessness is at least a year long, or they've been homeless 4 or more times in the last 3 years. So it isn't just that they're homeless, and it's not just that they're primarily unsheltered, but this has been their situation for a long time. They're long-term homeless. And that's more than 3/4 of the unsheltered homeless population that we interviewed. You can see in the bottom row, that chronically homeless federal definition row, that adds a requirement for a serious or chronic disability. That can be physical, mental health, developmental delay, or also a diagnosable substance use disorder. So even with that additional criteria, almost half of the unsheltered population meets that criteria. Going back again now to racial and ethnic overrepresentation, you can see here that Native American overrepresentation among the homeless is even more magnified within the unsheltered population. Like we looked at before, there are 2% of adults in Minnesota, 20% of people experiencing homelessness of any kind, but 32% of people experiencing unsheltered homelessness for 15 or more nights out of the last 30. And the reservation state is not included here, but it would be higher if we could include it in this graphic. And again, these are just legacies of a long list of traumatic episodes that have been visited upon the Native American population of our country and state. Where the Native American unsheltered population generally lives, more than half are in Hennepin County, about 10% in Ramsey County, and then a little under 20% in St. Louis County. So it's generally centered in Hennepin County, largely Minneapolis. Looking now at substance use, and you can see here just a really, really clear trend. And I think it's worth noting that everyone in this data set is homeless. So everyone at the time that we encounter them to interview them is really having a pretty tough go of things, to say the least. But when you look at the people who've been at least have been sheltered every night, substance use rates are pretty low. 2% fentanyl or heroin, 5% methamphetamine. And then as you go along this continuum up to people who are unsheltered most or every night out of the last 30, you can see the substance use rates just skyrocket. 43% have used meth in the last month, 30% fentanyl, 16% heroin. And then in addition, the rate of non-fatal overdose among people who have been unsheltered half or more of the last 30 days is 17%, so almost 1 in 5 people. And again, that is also an undercount of the overdose rate because that's only non-fatal overdoses. Our interview can't really um, suss out the reasons, like the relationship between homelessness and substance use, but I think it's worth calling out that it is not only that homelessness is caused by substance use. Substance use can also be magnified by being homeless, especially if you're out on the streets. People who work in this field are not going to be surprised or will already know this, but certainly people who are having to spend the night outside, some of them use meth to be able to stay awake, to be able to be awake and alert, and to be able to protect themselves and their belongings. or even just to be able to stay awake to keep moving so they aren't arrested for loitering, or other crimes of homelessness. And I think this slide to me really speaks to a need that we have to be able to meet people where they are in their lives. There just aren't many shelter spaces for people who are currently using, and you can see, if there's nowhere for them to go, they're just outside. And it's just a hard life, really hard life for people to have to live to be outside almost every night. Looking at experiences of violence and exploitation, you can see that women have experienced these things at much higher rates than men. 62% have ever stayed in an abusive situation because there are no other housing options. 48% in the past 12 months have been in a personal relationship with someone hit, slapped, pushed, or threatened to do so, and on and on. We did ask about trans identities and non-binary identities. There just weren't enough respondents from those groups to be able to report them here. But we did ask. So in this graphic, we're only showing men and women. And you can also see the data analyst in me is compelled to say that we can't, based on these numbers, say that for instance, 62% of women were in an abusive relationship because of a lack of other housing options while they were unsheltered or something like that. Most of these questions are if they've ever experienced these things. But I don't think that's something to get stuck on. It's hard to imagine a living situation more vulnerable than living primarily unsheltered. So if anything, these women are probably only more vulnerable in their current living situations. And I forgot to mention that women account for 35% of people who are unsheltered 15 or more nights out of their last 30. Looking at criminal background, you can see again just a very clear relationship. Almost half of people who are unsheltered 15 or more of the last 30 nights have a felony conviction on their record, compared to 24% who have 0 nights unsheltered. So when you're thinking about, trying to get these folks back into stable housing, it's very well known that felony convictions are a very hard barrier to many people getting back into housing. And so even if they were ready in every other way, this constitutes a really hard barrier for people to get back into housing. And then here in our study, you can see the very clear sort of circular churn of people who are homeless going into correctional facilities and then exiting right back out into homelessness. Of the people who are unsheltered 15 or more nights who'd served time in the past year, 84% were homeless entering the correctional facility, and 71% had no stable housing when they exited the facility. So pretty much exited immediately right back out into homelessness. Um, you know, and if we were interviewing them, then obviously that they eventually fell back into homelessness, but 70% basically were just immediately right back out into homelessness. All right, so kind of wrapping things up, going back to the beginning, there was a little bit of a decline in the total number of people experiencing homelessness in Minnesota as of the 2023 study. But when you put that together with the increase in number of people experiencing unsheltered homelessness, what you kind of end up with is maybe fewer people, but among those who are experiencing homelessness, a much greater need um, for services and for help. I'm sure there are people here doing that work, and thank you for doing it. It's hard work, and really appreciate you doing it. So a few key takeaways: people, even in shelter, are often piecing together places to sleep. There's again the alarming overrepresentation of Native American, Black, and Hispanic people among the homeless population, and especially among the unsheltered population. We have seen an increase in unsheltered homelessness in the past decade, and just overall high rates of very complex challenges that perpetuate cycles of homelessness, such as current and past trauma, significant health issues, and incarceration. And that's what I have for today. We are working on a report on Native American homelessness from the statewide study that should be coming out relatively soon. So keep your eyes peeled for that. There is also the report from the reservations study data, but that's going through approval. So that depends on what our tribal partners decide they want to do with the study. Generally, it gets released, but it is very much in their hands how they want to handle it. So thank you all. If you have questions, I can do my best to answer them. Otherwise, got some email addresses up there. Yeah, that's it for me.
Thank you, Walker. Do you want to stop sharing and maybe we can just open it up and
Yes.
thank you. Yeah, does anyone have any questions for Walker on the study or any comments?
Hi, Walker. Thank you so much for that presentation. This is Tanya from MDH. I wanted to ask does Wilder create policy recommendations based on research? If so, what would those be?
I think we do some, they're not like super formal necessarily, but I think especially from this unsheltered data, um, two of the things were just there's a real need for culturally appropriate services and shelter spaces, and also for people who are using substances. Those are two real gaps in the system currently where there just aren't a lot of spaces for people who need them.
I also wanted to comment that that it looks like the disparity in the unsheltered rates for Native American versus white residents of Minnesota seem to reflect in the overdose rates in Minneapolis, are like 40 times as high. So it feels like there's a concurrence there.
Yes, thank you.
There is a homelessness work group that you're probably aware of that works within the state. I'm not sure how it's all interconnected, to be honest, but I was in there yesterday and I was just thinking this information, if it hasn't been shared with that group, perhaps making those connections between what you've observed and possible things the state can do with that work group.
Yeah, my role traditionally is pretty internally focused, but I think Michelle and Rebecca are much more kind of out in the community. They may be familiar with this group, I'm not sure, but if you want to you can email any of us and we can yeah, get in touch, and if something works, we can work it out.
Sounds good. I'll do that. Thank you.
There's a question in the chat to Walker. Are there gaps in the data that you've noticed? And in an ideal world, how would that data fill in the study? It's from Kat Donnelly.
Oh, weirdly, I'm sure there are, but what's coming to my mind is that weirdly, people are always wanting us to make it shorter. When people are doing the study, the interviews are just so long, and it really can be kind of onerous on the people completing the interviews. But trying to think of.
You had mentioned trans identities.
Yes, there is that. It's and we do report on that at a statewide level. So if you go to there's a study, there's a website for the study, mnhomeless.org. And if there are for the statewide results, there are results for trans and non-binary respondents. Sometimes when we drill down into these smaller groups, like people who are unsheltered for 15 days or more, then you get into really smaller groups, and it sometimes isn't. We're just not able to share uh, those results because there just aren't enough people. But yeah, it's always uh, it's always a fine line, sort of trying to get representation of all of the various the diversity in the groups who we interview, and also trying not to um, make too much out of data where we don't have enough. And also, there are also concerns about things like confidentiality, and you don't want to. We just want to be responsible with things like that. So.
Thank you. I guess I wanted to clarify. I have helped collect the data in the past,
Mhm.
and I'm just curious, like, how can we help? Like next time it's time for this study, do you need more rural data? Do you need like what have you noticed as you see the overall big picture?
Ooh. I'm not sure I have a good answer for you, honestly. I'm not sure. Michelle and Rebecca would probably have a better um, eye on that. I think the unsheltered population is generally the hardest to get to, um, just because um, it's harder to find. There's less um, trust of like people coming in from outside and wanting to ask a bunch of questions, and to really believe that this isn't going to come back on them in some way. Um, so that would be probably the group if I had to identify one um, where we could use the most um, help, or yeah, we probably have the biggest gap in what we have versus what we'd like to have.
Awesome. Thank you.
I'm curious from your perspective, Kat, in having done the interviews for this, like if you have a sense of what could improve, like what barriers you've seen to folks completing, or just any feedback that you've gotten in during the actual interviews, from your perspective.
I think that's a really great question. I think my overall sense is that it really focuses on trauma, and it would be great to have a couple of questions about like what's real good about your life.
It does. This is true. And we did add a question this year. It's not reported in this presentation about what gives people the strength to, kind of keep going in their lives, and generally centers around community, family, friends. Um, Faith is a big one. Um, so yeah, but I agree. It would be great to get more. It's a very, very deficits focused interview. Um, and it would be great to get more um, strength focused items in there.
I also wonder a little bit, like unless I missed this, but I don't think I did, if there were questions about why people made decisions that they made about where they were staying. I mean, I guess I'm thinking of this specifically for, and I know with I'm definitely not a data person. I know with data, like you have to be careful, and then getting sort of like narrative responses is different, I'm sure. But in terms of, people making decisions to not stay inside, but stay outside an encampment, and are those decisions, I mean, is that a beneficial shift for some people? Is there more safety in an encampment than a shelter? I don't know, just questions like that about, I think particularly in terms of encampments and the community and the resources that are available in encampments. It might be interesting to know, yeah, just about, what people's experiences have been in different kinds of environments, in terms of like safety and access, and how.
Sometimes it might be a preference.
Yeah, right. That's their, individual preferences that inform that kind of thing. And anyway, just a thought.
Yeah, no, you didn't miss anything. We don't have a question in there. It is an interesting question. So I can't speak to it anything more than anecdotally, and honestly, you all probably people who are providing services probably have a better sense of it than I do. It is a preference for some people, either because for a variety of reasons, distrust of systems, or trying to stay away from substance use, and their substance use in the shelter they would be at, or there's a variety of reasons. But I'm gonna write that down before I forget it. But that's an interesting question, and it is. You just mentioned kind of briefly, we don't have a lot of kind of narrative type questions, just because with the number of interviews we have to do, those questions are just more to handle than the information is richer. It is. But we have scarce resources, so we kind of have to figure out how to get the information the best ways we can. But thank you for that question.
Walker, would it be okay for me to, with my follow-up email to the group, to send your slides that has your contact information and Rebecca? Okay, great.
Yep,
Thank you.
definitely.
Does anybody have any other follow-up questions, comments? And then in the chat, Anna put the link to the homeless study. Thank you, Anna.
I haven't mentioned this, but now wait till the end. Anna is my spouse, so this has been a little bit of a weird experience to me presenting. She is literally upstairs in my house. She could have been sitting right beside me for this whole thing. So it was kind of funny, but my dear.
Hi, great job naming the awkwardness. Thanks for being here.
Yeah, thank you for being here, Walker. It was an excellent presentation. Lots of information to wrap our heads around. And yeah, I'll make sure to send all information out to everyone that joined today, so that you can reach out if you have other questions. But yeah, thank you again. And thanks everyone for being here. Next session will be in 2 weeks on June 18th at noon. Thank you. Have a good day.
Thank you all.
Thank
Thanks for
you.
coming.
Thank you, everyone.